$2,500 basically for almost everybody. And so they range between 20% and 40% copays that you're going to pay. Well, there isn't a whole lot that you can do in medicine without, having to pay quite a bit of money. So all of this for, minimum of $2,500 out of pocket to have some minor surgery or some little thing, done for you. With a laser, the cost of insurance, just for a couple of months premium, you could treat your entire body. And I'm not recommending this to everybody else, but personally I canceled my insurance. This is my insurance. It really is. Under the new laws, if something really bad happened, I can always sign up for insurance. I know that sounds horrible because that's using the system, but that's the system they gave me, and that's what I'm using. But for the cost of what, less than what your deductible is, you could have major work done with laser. I mean, you could do almost anything you want with laser for under $2,500. And that includes repair of surgical procedures. I've had a number of injuries myself. I had cancer taken out with some black salve, left a big hole in my eye, above to the side of my eye, and just using the laser in 1 week's time, cleared in without hardly any scar tissue. There's just a little nice there instead of a twisted. If I just done this much, it would be like twisted like that. I sawed through my hand down to here with a skill saw. 2 days later, I'm seeing 40 patients a day all week long without any trauma to it, without any reddening or excessive swelling. A week later, I took it out and it was all better, and to this day, there's no thickening or hardening of that area where the scar tissue is. That hamstring pulls that normally take months to get through, a ball of muscle sitting there from being torn. A week later, I'm playing without any bracing at all, having duty game of tennis without any. Trying to remember which one I did it to. Couldn't even tell. So there's lots of things that you can do, and but the difference between physiologic versus pharmacologic, it's a little less predictable about how well it's going to do. All it's going to do is the best that your body can manage. That's all it's going to do. When you get all of the different tissues working together the way they're supposed to work, you see the kind of miracles that Jesus performed, really. I mean, basically he used natural law. Maybe we don't understand that, but he used natural law to heal. And the more we can get our bodies to heal, to work as well as they're designed to do, we can have actual healing miracles happen in our lives. I'm not comparing myself to what he does, or the laser, but it uses the same principles. It uses natural principles of healing, and when the body is working the way it's working, it is miraculous, and you do get miraculous healing. And there are some things that it's not going to heal in the time you have left to live. Some tissues are less metabolically active. Bone is slower to heal than liver. Brain cells and nerve cells are slower to heal than bone. There's just, even at maximum, they heal at certain levels for a reason. I'm sure the body has some reason why it has to be at the rate it heals, at the way it metabolically is active. But we have the ability to turn them on and work much faster than we're used to having happen. And that's what my goal is try to introduce this form of healing to as many people as we can, so that they don't have to go through the difficulties that you have through using pharmacologic drugs. Many of those pharmacologic drugs should never have been given to begin with. They're there for this. Some of them are very important and needed, and for the right person, that was a good thing. But they try to maximize the profits in everything they can do, and if we fall for that, then we're not going to be as healthy and live as full a life as we can live. The more drugs we can stay off, the healthier and longer we're going to be kicking around and enjoying life. We want our patients to live long and die short, rather than die long and live short. Okay? I mean, some people are just kind of going through life slowly dying, and then they finally die. And we want people to up, you know, with a massive heart attack in our sleep or something, or hitting that last, you know, shot on the tennis court. That's what my dad says. I hope I die on the tennis court. And I says, well, I don't think I want to be there, being the one that hit the cross court shot to you. But he didn't have his wish quite that way. But he did live a long and good life. I think that's about all the time we have today.